Hey, how's it going? Welcome to Ever Forward Radio. I'm Dr. Dom Fraboni, your doctor of physical therapy, and today we're going to be talking about mindset, movement, and meals. We're going to help you find your Horizon event so you can empower yourself to independence on your wellness journey.
3, 2, 1.
I do strong coffee episodes like once a month. I call it my coffee talk. And it's usually me and my guests or just me kind of talking, drinking over coffee as if we were like out getting coffee somewhere.
Absolutely.
But man, it's just staring at me over there. I was telling you, it's past my caffeine time. It's too late, but it's so good, man.
Dude, I can hear the strong coffee calling me in the morning. Trust me.
Like, I know what it is for me. Like, it's different, right? This is coffee that hits on a different level. Please, what's your experience with it?
I don't know, the first time that I tried it, everyone that pushes this collagen product, but whatever, I'm like, I'm just going to go in and see how I feel, right? I didn't want to read too much into it, but really you can't fake the feeling.
Yeah.
And so it's really the first few times that I drank it. I mean, you know, with your normal coffee, it gives you that kick and then you're working hard, but then you midday kind of feel yourself get into this lull. And when I take strong coffee, it's just like you don't hit that lull, and you get that acuity,
you go, baby.
Man, you get that acuity, you get that focus, and it just helps you ride through the day. But yeah, you don't crash like you do on a normal cup of coffee. So that's where I really like it, and it just tastes good.
So good.
So
it's so good, man.
Yeah.
Well, I guess officially now we're on our strong coffee episode.
Heck yeah.
It's
going
like
strong.
Sometimes when you don't have a script, you just realize that you're just changing things as you talk and go. But we'll go with it, man.
Oh yeah.
Dude, Dom, welcome to the show, man.
Thanks for having me.
Your energy is amazing. We've been kind of getting to know each other a little bit more and more the last couple of weeks. You know, through Adam, really. You know, shout out Adam von Rothfelder from Strong Coffee.
No doubt.
You know, he's always plugging me to cool people, and I'm sending him cool people, and it's like good people recognize good people, man, and good people recognize good coffee.
Absolutely.
That's for damn sure.
That's for darn sure. Heck yeah.
What's it been like kind of getting in this world now of, I mean, just it's meeting people. It's you know, introductions. It's kind of, for me, I realized that pretty quickly of like, oh, like this is how things get done. And this is how it needs to get done if I want to kind of like grow and excel and just keep learning, being a sponge. It seems like you kind of like jumped into the deep end pretty quickly, right?
Yeah. I'd say like about 12, 14 months ago, I was really not doing anything online myself. You know, I was still working in a clinic. I just graduated from PT school, was getting into some clinical work, and that's when I met Jen. And, you know, she does a lot online, obviously. And the thing that I started to realize as a physical therapist, you know, I can maybe see like 15 to 20 people a day.
Right. Yeah.
That's a lot. If you're seeing 20 people a day in a clinic, like for any people who work in a clinic out there, like that's a fast day. But if you can harness the power of online and you put out good information, you can reach so many more people. And you can good information into people's hands can really change people's lives. And that's what you start to notice when you put information out. So yeah, I think that the first tough step was just authentically presenting yourself, whether it's online or in person with people. I mean, some people I feel like try to chase the engagement, but in reality, just putting yourself authentically is what's going to draw in the people that are going to vibe with you, that are going to engage with you, and they're going to love your information. And
stop trying to find the people, just be you and they'll find you.
Yeah, absolutely. So I think that, and you know, the greatest thing about kind of learning from Jen is that when you put yourself out authentically, those people will come in. When you try to be someone you're not, then you're going to draw in, you know, different types of people, different types of energies, and then you might be disappointed with the type of people or clientele or customers you draw in. So, I mean, really, it's been a matter of being super authentic, getting with people, showing them my energy, and hey, if we don't vibe, we might not hang out every day, but that doesn't mean we can't have a great experience and learn from each other. So
absolutely, man.
Yeah, it's been awesome, and I truly think that we are a product of the experiences that we have in this world and the people that we have them with, and so I'm going to keep putting myself with awesome people to continue and grow those experiences and then just grow my overall human knowledge, really.
Absolutely.
Yeah.
Very well said, man.
Yeah.
Why DPT? What was it about this profession that pulled you in?
You know, initially, like, it's funny. I went to school for music. I wanted to be a music educator. Yeah, I wanted to be a choir director. Funny enough.
Choir director to doctor of physical therapy. That's like,
Yeah.
What's the story there, man?
It's a bit of a jump.
Right.
I mean, I took piano lessons growing up, loved playing piano, had a choir director who was he's probably like one of my favorite male mentors growing up, because he taught me what it was for a guy to stand on a stage and just sing his freaking ass off. And like, and that's something that's like, especially growing up in small town Minnesota, like as the big football player guy, like it's a classic Troy Bolton situation. You don't want to be the one to just get up there and
so you sing.
So yeah, I mean, I love singing, I love playing music and stuff. And so initially I was thinking about going into that. And then I was like, it's probably a better hobby than becoming married to the music. And my dad was a physician. So I'm like, I love the body. I love health. That's kind of was my initial, like, I'll go into pre-PT. It was kind of just like, threw it out there. Loved the body, loved learning about it. And then really what grasped me in was these two mentors of mine now, Eldon Johnson, Chris Kramer. They were two of the first guys I observed in the clinic. And I just noticed how they connected with people. And they saw so many people, and they'd bring them in, they'd put a smile on their face, they would send them out laughing. And I just noticed how they interacted with them. And it was much more for them about how the person felt when they were in the clinic rather than what they did or what they said to them, about their specific condition.
Right,
yeah. I joke, tongue in cheek. I mean, I can treat somebody good and I can rub peanut butter on their knee with a spoon and their knee's going to feel better, if I do that for 20 weeks for them, like, and we just like make each other feel good and hang out and like, it's not about what you do. It's about how you treat the person and how you make them feel confident about themselves. And that's what they told me. They're just like, half the battle is just making the person feel comfortable with you. And it doesn't matter as much what you do. So I just realized the ability to connect with somebody, especially when they trusted you. And once you form that connection, you can really make some profound change in their overall health. So yeah, I loved learning from those guys. They taught me it matters so much more what happens in the head and in the heart than what's happening at the shoulder or the knee or the foot.
Do you think it's kind of a necessary step? Is it a vital component to healing for someone who's in the patient role, the patient treater role? Patient provider. I haven't been in the clinic in a while. That relationship, that kind of connection, that level of trust and ease, do you say is that missing for a lot of people? Maybe that's why they don't heal and rehab as properly as they could or should, or what's your kind of take on that?
That's a really good question. And especially in America, I think that we run into some challenges because of the system and some of the inherent, what I would think are problems or, again, challenges. Because I say it's a problem, but there's a lot of things that would go into a solution. Mm-hmm. We'd like to try to treat to a certain standard, right? And a lot of those standards come from research studies and blah, blah, blah. But generally what that does is it helps us treat to the average, right? And so when you have hundreds of thousands and hundreds of millions of people, like, you can't, everyone that comes into the clinic and everybody that comes into the hospital, it's really hard to take that time and dice through their whole situation and take the time to hear their story and, put it all together and then give them this comprehensive plan, right? We kind of developed a healthcare system that's this plug and play method. We wait till something goes wrong, essentially.
It's a sick care system.
Till we have a sickness, till we have a symptom, and then we fix that symptom. And so we don't do any of that underlying, holistic root cause care. And that's kind of how the system develops. So now it's really tough to kind of back our way out of that and really start to treat people, as a whole person and start with the psychosocial stuff and get into their emotional, mental, spiritual histories. Like, if you start talking to the average doctor about that, they're just like, okay, that's not going to happen.
Yeah. Good luck.
Yeah. Right. So it's tough because of where things are at now. It would be tough to think about like really launching into, now we treat everybody spiritually, emotionally, mentally, because it's really tough with the time that we have in the average hospital visit, for a provider.
Yeah. I agree. It has to be a complete paradigm shift.
Yeah.
I'll caveat that by saying the change that I think we are after, that I would say that a lot of the world, a lot of America especially, is after, it's going to take a complete and total paradigm shift in the healthcare system. But it doesn't have to be at that level to start to get to some of those changes. So like, what's worked for you to kind of get you into that mindset for your own health and wellness and well-being, to recognize that I don't need to change my entire existence. I just need to change one thing here and there, and that compounds to transform my entire existence.
Yes, I think that's a really cool concept, is like when people think about their health and then they think about all the things that they need to change or fix in their health. That's way overwhelming. You know, if you listen to your average wellness guru, they're going to say like 27 things, you know, in 10 minutes that you should be doing.
I got 26 things.
Yeah, you're at 26? Well, you're ahead of me. I'm at like 4 right now.
It's like 8-minute abs. No, it's 7-minute abs. 7 minutes.
Yeah. But what you said is it starts with one commitment. It starts with one, you know, key behavior, or what I call like a horizon event. A lot of people have this horizon event.
Perfect example.
You know, where you have one thing that you do that significantly changes how you feel, and then that really gives you power, and it gives you some empowerment to realize, oh, I did this, felt something different in my body, and now you are empowered to maybe start making more of those choices. For me, an early one was breath. You know, I had a really bad car accident and I was going through some traumas in life and was having night terrors and anxieties.
Oh, wow.
I played football in college, so I was having some post-concussive symptoms. Like, I was working in this clinic for 2 or 3 months and I couldn't remember patients' names or their caregivers' names. Wow. And I was like,
it was affecting your daily life.
Yeah. And I'm like trying to walk around in a neuro clinic. I'm working with people with brain injuries, dealing with a brain injury myself. And I'm trying to like hide this so people don't realize that I don't even remember my patients' names.
Oh my gosh.
And and so I started getting into this breath work, and night terrors just melted away. Anxiety just dissipated. Started realizing when I would feel that in the clinic, I would just have to, you know, duck into a room, take some breaths, turn off the light, you know, wind down a little bit, and boom, it just immediately gave me back that power over something that for a few weeks there, like, was one of the scarier things that I had experienced in my life.
I can imagine.
Right. And so that, I'm like, wow, just by breathing, just by journaling, I started journaling daily after that because that helped with my memory. And I started getting into some more dietary practices with whatever smoothies and experimenting that way. So that was like my horizon event, like I said. And that really, you know, catapulted me into focusing on more behaviors because I had that first one.
Yeah. That's all it takes really is one conscious choice that I'm going to change this one thing in my life. I'm going to change the way that I go to work. I'm going to change my grocery list. I'm going to change. I'm going to wake up 5 minutes earlier. All you need to do to change your entire world is to change one thing. And then just be along for the journey and pay attention to the journey, because that one thing will teach you the next thing, will show you the next thing, will show you the next thing. How do you kind of help people realize that now? You've had your horizon event. How do you help other people realize theirs? I understand your big focus, and I'm with you on it, man. It's mindset first. Is that kind of like your lead domino with people? Absolutely.
I kind of take like a 3-pronged approach where I say mindset, movement, and meals, right? And mindset, like you said, is foundational. That's the first one. And I think that's where the breath really helped me trigger into this mindset, like, oh, wow, I can. It sounds cheesy, but it's like, so what do I need to do in the room with somebody to either give them an opportunity to have their own horizon event, to give them a practice that they'll start doing on their own to feel that difference in their own body. A big place I go is breath. You know, through our breath work, we have access to the most powerful medicine cabinet in the world, which lies right between our ears and our brain. Most of the drugs that are prescribed these days, you know, with breath and different breath techniques, we can get the same physiologic response in our body, whether it's anti-anxiety, antidepressive medications, pain relief. We can trigger those things in our body. And it's just a matter of a provider sitting with somebody and getting them to be open to trying it, right?
Just being, exactly. Just being open.
Yeah.
Like that's literally all it takes so many times.
Yeah, because sometimes you start talking about like breath work or meditation or something and you lose someone right away because that's just not in their ballpark. That's not in their realm. And so again, I'd say the first thing that helps open people up to having this for themselves is listening. And again, it sounds cheesy, but most people, by the time they get to me or Jen, we both kind of work with similar types of people, have gone through this 10 to 15 to 20 year journey of being spun through providers that haven't listened. And I
like,
noticed,
here's just another person that's not going to care, not going to listen, and which is really saying, I'm going to keep living the way that I have been. I'm going to keep being in pain.
Yeah.
I'm not going to be able to live the way that I want to.
Yeah.
Yeah. It's
And
hard.
a lot of people walk into their next appointment expecting that, being ready for that, and preparing themselves for the disappointment. So when you have somebody that has that kind of history, that kind of trauma, literally, that has told them so many things about themselves that is wrong from all these past providers, right? And now they've labeled themselves to the nth degree with all these diagnoses and all these things. And then they get into my room and I just want to listen and ask them questions. And, you know, by the time they're done with like a half an hour to 40 minutes of like just spewing everything out, you can just tell that they're just like relieved and they're just like getting it all off their chest.
You've helped them realize that you too are a human.
Right.
It's the humanization component that is instrumental.
Yeah. So it's once they get done with that story, then it's like, they'll ask me, is like, so what? And then I kind of turn it around on them and I say, I don't know. So what?
Yeah.
Why not? And really it's about continuing to ask those questions. My dad's a physician and he taught me one of the most valuable lessons early on. He said, Dom, a lot of physicians are smarter than heck. Most are smarter than me, but I promise you, they just don't get out of their own way. And that's why they never figure out what's actually wrong. The person tells you in the first 2 to 3 minutes, they tell you exactly what's wrong and usually exactly what they need to change in their lives, right? It's about continuing to dig in to understand why that's important to them. Because once you can get them to tell you why it's important to make the change, whether it's a kid that they have, whether it's a grandparent that they need to take care of or want to continue to visit, whatever it is that's important for them to make the change, that's what's going to help you drive those behaviors or that what. So it's really about discovering the why.
It is. As you were talking, I kept going back to so many just examples were coming to my head when I was in my health coaching practice. And I say it all the time. I'm going to keep beating the dead horse here. Is the greatest success I ever had with any type of client, regardless of the goal, was when the humanization component finally clicked. I stopped trying to give them everything to do or tell them what to do, but I just made space and a comfortable environment to just let them talk.
Yeah.
And like you just said, like your dad told you, they will tell you everything that is wrong, that they think is wrong with them, all their barriers to success, things that they think they could try, should try, want to try, but don't, and their definition of success. And just like you said, man, like I stopped telling people what to do. Of course, we're there to be coaches and guide them, and we kind of have our expertise to fall in when we need it. But it was like, oh yeah, so like, and that's why I do this. What should I do?
Yeah.
What do you think you should do?
Yeah.
And then when they do it, it comes out of their mouth, and they realize, oh, yeah, there's a horizon event.
And it helps them take ownership over the positive things that start to happen in their life, because someone will go through this whole story and they'll list off all these awful, tragic things that are going on in their life. And they themselves generally throughout the story will say, well, I had this, and that helped a little bit. But then they go on to the next bad thing. And they don't even hear themselves say out loud, like, that helped a little bit, right? It's so much easier to focus on the immediate negative things there. But, we don't want to pick up those 3 or 4 pearls, like, wow, I did these 3 or 4 things and they helped a little bit. But there were all these other things going on in my life. I wasn't open to focusing on that could have made a difference. And so you start to switch the mindset and you learn how to magnify the effect of that. Because again, you switch your mindset and you get your own brain juices working for you. You can do the same thing and it'll have a profound effect where the first time it may not have had effect at all. So you help people start to revisit and retap into those things that they say from their past either have helped, things that they like to do. Oh, I just love to go out for a walk at sunset. Okay, why don't we do that every day? If that makes you feel better and helps you sleep better.
You just tell me what you love to do, what gives you the most joy. Why aren't you doing it? Like, oh, I don't know.
Yeah, right. And so it is a little bit of that affirming how somebody feels. Because again, you're never going to tell somebody that the way they feel is wrong or not correct, or you're having that symptom. That doesn't make sense. Like, you have so many people who are like, a doctor basically told me that I'm full of crap for the symptoms that I'm having. Like, okay, whatever. So you always affirm the way someone's feeling and then continue to reaffirm the things that they have told you have positive impact or give positive energy to their life.
So that's step 1.
Yeah.
You got 2 more, man. Fill us in. Keep us going. What are these other 2 components?
Right. So the next 2 components are the movement and the meals. And I generally find that when you address some of these underlying motivational things, the other ones fall in line, whether it's meals is difficult, we'll save that one for last, but movement, again, everyone thinks has to be some massive sort of exercise component. I have to have this hour chunk a day that I'm going to go out and do X. And in reality, that's not how human bodies were built. That's not what the purpose was
it's
to
not
just
necessary.
Go to a gym and crush it out for, an hour or 2 hours a day. Like, no, our body's just built to move and flow and be purposeful through our environment for 14 to 16 hours a day, So if we just crush a workout and then go sit on our butt anyway, what do you think we're going to adapt to? So again, through all that, mindset stuff initially, then we start to tease out some of the movement things that, bring joy to them. Your movement and your exercise should not be something that you dread. If you
I'm
need
so glad you said that.
Right?
Yeah,
if you need to drag yourself out of bed and, get into a cold car and you're just like the whole way bitter about, being on the way to the gym, like let's find something different here.
Yeah.
So
Amazing.
I don't know, approaching it in a way that the movement that you do helps you, again, feel something different, feel something positive. That's when down the road, you're going to start to see the other positive benefits of that, like aesthetic changes, like weight coming off, like yourself just being more physically active in general and not even thinking about it. Because initially you focused on, I just went for those walks outside, which I love, made sure to get on the balcony in the morning and do my breath work. Boom, that's like probably enough exercise for the day for the average person.
Absolutely,
right?
Yeah.
If it's done intentionally and then your body feels amazing, you're gonna have so many more physiologic benefits from that.
You've had a really unique journey, and I would even say kind of transformation with your relationship with fitness. It sounds like with movement. I mean, you said you played football, and now you're a DPT, and now you're talking about just movement in general, not just beating your body in the gym every day. What's been your fitness journey, and what are like the realizations you've had from each kind of season of Dom in each one?
Yeah, that's a really good question, because I think that, the people who are into movement the most generally have their own story that has taken them through twists and turns. And, starting in football was foundational, because what do you do in football? You lift lots of weights, you throw your body around and smash it into other, big human beings. And it's inherently just a really aggressive and rough sport on the body. So another challenge is that you're in an environment with a whole bunch of other guys that are competing, right? So when you're in a weight room in an environment like that, what's the drive? To lift the most weight.
I gotta outdo this guy. I gotta outdo that.
I gotta put up the most weight. And so I just always remember it throughout college being about putting up the most weight, having the highest squat, benching more weight. And, we never really focused on just some of the foundational movements that I was lacking in. So I get out of college and I realized that I'm not flexing fully through my shoulders. I don't extend enough through my upper back. I'm way too extended through my lower back. Hips are tight. Knees were taking a lot of pressure from where my hips were tight. Ankles don't have enough dorsiflexion. So like all the way up and down my chains, I get into PT school and I'm just like, man, I got some stuff to work out.
I'm way too young to be feeling this damn old.
Right? And I'm like, now I understand why my back feels the way it does, because I squatted hundreds and hundreds of pounds and my body wasn't ready for it foundationally. I didn't have the basic movement patterns to put that kind of weight on my back. So again, I wouldn't trade my college football experience for the world, because of the memories and the fun that I had doing it. And it did help me keep my body in good shape in some aspects.
Yeah, absolutely.
And also, now through my PT journey and, through meeting Jen, I continue to work my body back. So I just have more foundational control over it. I'm working into a lot more things with body weight exercises, because I just find that I was lacking baseline mobility in hips, upper back, shoulders, and I was compensating in my lower back and knees for that. And I've been having some issues, or I was having some issues because of that. And now when I went back to the foundation, just did basic mobility, I now feel more strong, powerful, and controlled through most motions that I even would have done as a college football player. I could probably
You're
lift
more connected, it sounds like, in every way. Yeah.
And I would probably lift significantly less weight as the number, but functionally and explosive wise, I feel like I'm at a place now that I'd never even reached back in college. So
that's awesome.
Yeah.
Where do you want to go with it? I mean, you've gone through so much with your physical fitness. Now that you kind of know what's possible with your human body, where do you want to take it? Do you have any big goals or training modality shifts? Or
I guess one of my big goals is I've been working into handstand stuff.
Damn. Okay.
I'm dating someone who can like walk on her hands for hours. So,
you got to at least give it a try, I'm sure.
yeah. And I think for me, it was like coming from football where you're always on your feet. Again, your goal is to lift weight and to be able to carry your body to the end zone, right?
Yeah.
Whether or not other people are hanging on you. Going into stuff like when I graduated, like rock climbing, doing more bodyweight stuff, animal flow, where it's all about controlling my own body, I just realized to an extent how big of a mass of worthless junk I was. like, man, I've got all this extra weight and it's just like weighing me down, you know? And like I'm doing things like rock climbing and animal flow and trying to get into handstands. And I just like had way too much mass on me. Again, that was probably restricting me in ways. But now working into handstands, rock climbing, it just gives you so much more freedom when you realize what it means to actually control your body and have that foundational movement at certain joints. If I go back 1 second, even into that football type environment, something I hear a lot of guys talk about, especially once, you realize what it really means to be healthy and be able to functionally move throughout life. I feel like in environments like a football locker room, really a lot of guys lift to build this external armor to really hide some of the things that we truly need to be vulnerable about as guys, but aren't willing to open up about,
To put more distance between what's going on in here and everybody else.
And everything else on the outside. And I think that myself and a lot of other guys that I knew fell into that trap of wanting to continue to build up this armor so that we didn't have to show our true inner weaknesses or what we saw as weaknesses. And it was once I started being more vulnerable about those things, then started working on my health differently, started working on my body differently. It all kind of came together. So I do think that a lot of people are just training for the wrong reasons in some aspects. And I think that was a component of what I was doing back then versus now. So where am I taking it? I'm taking it into a place that I want the movement that I get in life to always bring me joy, to always help me explore my world and explore it with other amazing people.
Yeah.
And, as long as my body's going to be able to carry me through the world until I leave it, what else is the purpose of keeping a healthy body?
Amen, brother.
Yeah.
Amen.
Yeah.
I'll kind of take it 180.
Yeah, let's do it.
So big part of my audience, everybody listening, watching, hey, what's up? We very much care about our bodies, moving well, being well, looking well, just holistic wellness. But I mean, I used to be a bro. I used to do, all the things. I don't need to get into it, but like sometimes we just want to get big, right? Sometimes, like training, there's nothing like it. It's amazing. So how would you, to the person who is in that mode, like I'm building mass, I'm building strength, I'm building up, for my own personal reasons, strength, I'm building up hypertrophy. How can they do that while also being mindful of all these things that we know on the back end of? You got to watch out for mobility. You got to watch out for your flow. You got to watch out for your joints. What would you advise to someone who like to get big, to have hypertrophy, but in a smart way?
That's another very good question. And a lot of times building hypertrophy is
it's kind of loaded. It's a lot of things going on there.
Totally. And, building mass and building muscles, fairly individual, which is one thing, depending on what you're going to be taking in for diet and whatever. The one thing that I would just say, if we're just going to talk about, I do want to lift heavy. I want to power lift, whether I'm competing or whether you're, training for a physique competition or something like that. My message would always be, know the reason why you're doing it, right? We talked about that for a while, but also, getting with somebody who has done it before, done it well, trained their bodies correctly in doing that. Because, when we talk about just gaining mass, whether it's for a competition or lifting heavier weights, there's a lot of ways to do it incorrectly, especially for your own body. And as humans, we're master compensators. So again, if it's something that you're not super well trained in or something that you haven't done a lot of the baseline training in, that'd be my first suggestion.
Okay.
Either go get with somebody who knows how to do that type of training without injuring yourself. When we talk about powerlifting, there's a lot of inherent compensations that people can get themselves in trouble with. When we talk about training for like physique or bodybuilding competitions, there's a lot of inherent issues with how people might eat or how people might treat their bodies. So again, knowing the reasons why you're wanting to go in that to start, and maybe having a mentor or a group around you that is also doing those same things for really good, authentic reasons. if you surround yourself with amazing people to do an amazing event or, achieve something that you want to achieve, there's that much better of a chance that it's just going to be an amazing.
More sweet. Absolutely.
Yeah. So I would say just always know the reason you're doing it. Surround yourself with people who are also doing it for good reasons. And then make sure you start at the foundation, because there are always the base steps. And the people who think that they're good enough to jump those steps generally find out later in life that wasn't a good idea.
So true, man. So true. Well, I'm going to keep picking your brain a little bit more. That's why I love having certain experts in these fields. Let's get a little bit more, technical.
Sure.
A couple things come to mind. Personally speaking, last year I had a pretty nasty rotator cuff tear.
Yeah.
Wasn't a complete tear, but excruciating pain, sling for weeks, no upper body movement for a long time. And since then, mobility, range of motion, proper loading, just isometric stuff has been a lot more my focus. Honestly, because I'm a little bit scared. I'm a little bit worried that maybe I didn't do enough rehab. Maybe it's going to happen again. Whether it's a rotator cuff or another injury, how would you advise someone to kind of like properly work through an injury if it maybe is just kind of fear holding them back?
Fear is like something that's really, really powerful as a driver, and something that really drives fear is pain. You just brought it up. Suddenly you couldn't use your shoulder for a couple months. And I'm sure there was a lot of pain that was associated with that. And then you get out of it and you suddenly just living everyday life. There's that constant reminder. When our brain starts feeling something for greater than 6 months, especially pain, we start to form these patterns in our head. We have certain centers that deal with pain in our brain. We have certain centers that deal with the shoulder, right? And after 6 months of feeling that pain, having some sort of fear associated with it, as soon as we even think in our head of raising our hand overhead, those pain centers start to light up.
It's like,
right? They've already learned. They're like, nope, when you do that, we get pain. So we're already just going to flash some pain at you so you don't go any further.
Okay.
Right. And so we start building these patterns of fear to even go back to those movements. So I think a really important thing is, well, of course we have to address the fear, but why did we injure that in the first place? It's funny because a lot of the things, you started talking about, it was all about the shoulder, right? All the things you're doing is to train the shoulder. We're getting extra range at the shoulder, but there's probably a foundational reason that your shoulder was doing extra work.
True.
Is it because your shoulder blades weren't
compensation thing? Yeah.
Are your shoulder blades not rotating out well? Are they not upwardly rotating? Do you not extend through your thoracic spine? So you just kind of are jamming up into your AC joint, which is what a lot of people do when we're a little bit more forward in our thoracic spine or shoulders. We just don't have as much space for our rotator cuff to do its job, right? Are we over dominant in our chest and our shoulders and our traps? So again, one of the first things is I always say, if you work with a PT and you have shoulder pain and they only ever touch your shoulder, go find someone else, because
they can do a little bit better.
Right. Yeah. You can rub around the shoulder, like I said earlier, whether it's a mushed banana or your hands, like the shoulder's probably going to feel better eventually.
Right.
But there was a reason it injured in the first place. So are we going to be able to go back to all that high level stuff if we don't do anything else differently than just strengthen the shoulder? So, getting with somebody who can help you understand why foundationally you might have hurt your shoulder in the first place, that can give you a little bit of relief from, okay, so maybe I should just work on my upper back more, shoulder blades more, then my shoulder's going to be taking less pressure. You can kind of have somebody who can talk some ease into you and give you that plan to say, like, you know what, maybe if you even work on some core stability, that's also going to help you feel more comfortable here, and here, and take less pressure off the shoulder, right? And there's, again, all sorts of specifics depending on your injury. But getting with somebody who can help kind of alleviate that fear and get you to do some of the motions pain-free, again, then we can start to desensitize the brain. So for you, it's like, if initially when you started raising the arm, there's some hesitancies and there's some flashes of pain that want to come up, that's okay. If we can make it through that range 5 times today, great. The pain's not any worse, great. Do it 5 times the next day and the next day. And again, if
let's
we've
uncondition that approach.
Yeah, let's uncondition that fear. And if you're working with someone else foundationally, like, we can trust that we can then strengthen up, avoid the reason you hurt that in the first place, and then again, retrain those centers in the brain that may have been kind of conditioning into fear of movement and some chronic or persistent pain patterns.
In your professional opinion, would you say that, big blanket statement here, would you say that most injuries, whether it's someone who's extremely active or sedentary, most injuries that we as humans go through is not 99% of the time because of an injury to that exact joint, tendon, muscle. It's because of all the other things that are out of whack, out of alignment, you know?
Yeah, there's this thing called regional interdependence in like health. And as PTs, we usually think of regional interdependence. Like, okay, the knee would be regionally interdependent with the ankle and the hip because it's the above and below, right? You should immediately look above and below. If you have an injury somewhere, above and below. And, you know, I wouldn't say like, so if I injure my knee, like me on the inside of both my knees, I have meniscal issues, right? The damage is in the meniscus, right? The injury is at the meniscus, but
you can't deny it.
Yeah, but
it's there.
The underlying like root cause for me is because I have a lack of dorsiflexion at my ankles. So I always tended to let my feet go a little too far out, and my hips, I just didn't support through enough. So I would extend through my low back a little bit more, right? So my knee injury likely was contributed to by lacking, you know, range of motion in my ankle, my hip, lacking some support in my low back. Yeah. So I would generally say there's other contributing factors. It's rarely because like, oh, your rotator cuff was just weak.
Yeah.
No, it's just your rotator cuff couldn't compete with your pec, but nobody's rotator cuff can compete with their pec.
It's so funny you say that, man. I'll actually share with you how that happened.
Yeah.
I was squatting.
Really?
I was in the hole.
Pushing like this?
Yep.
Yeah.
Doing my traditional 5x5. I'll never forget. I was on my third rep in my third set. And I was down in the bottom. And as I was exhaling, coming up, all of a sudden heard and felt pop, excruciating immediate pain. And when I went to, you know, emergency care or whatever, like, oh, what happened? How'd you hit it? I was like, nah, I was just like this. I was squatting. like, how much of an idiot are you to like injure your shoulder squatting?
How do you tear your rotator?
Yeah. And then, I mean, then I went through all the things that I should have been paying attention to before, pec minor issues, bicep tendonitis, tight lats. Look, all these areas, all these things where everything's coming together that I wasn't paying attention to and compensating for, overcompensating. Well, no shit. It's no wonder that like that meeting point where all these things weren't getting the attention, like that blew up on me.
The one thing that I hear a lot of people say, especially if it's like a rotator cuff injury or biceps slap lesion, you know, some of these common things that you'll see that are like, to me, more degenerative issues. Yeah. That people suddenly think like, oh, I literally just reached for a can of soup and I blew my biceps out. And I'm like, okay, that probably wasn't the event, but for the
final straw.
For the 40 years in the past, you've just been steadily putting more and more pressure through that bicep and just yanking at the tendons, you know? So again, that's where I think that in our country, we need to have every 6 monthly like movement screen, whether it's a PT, an ATC, a chiro, a trainer, anything. We just need to learn more about the quality of our movement, because living in a world that's requiring us to move less and less every day, every year, we're accelerating towards this automatic life where we can just sit in a seat and have things delivered to our home and dropped in our lap. Like pretty soon kids aren't going to know what it means to just have these daily outdoor routines because of how we're constructing this world that limits our ability to move or need to move, right? We don't need to move to survive anymore.
Yeah.
Right? Which is really scary. So getting with someone consistently who will take you through what normal human movement looks like, and assess and say, okay, if we work here, 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 and here, we might be able to prevent putting too much stress into these areas over the next years. See you in 6 months.
Yeah.
Right. And if we did something like that, we could prevent so much downstream injury that would take, you know, high cost intervention to fix or to help, you know, whatever symptoms happen if you tore a muscle or if you broke a bone or whatever it was. But if we get at all those underlying compensations, we can prevent so much downstream. So I think there's a huge opportunity for all those different professions I just named off to start getting at people before the problem does.
Yeah. And I mean, I can't wait. In this week, next week, I'm going to be getting some body work.
I'm going
to have you kind of just like break it down. I mean, as someone who is, you know, gone through it professionally and still so personally interested in the human body. Yeah. I mean, I know a lot of stuff, but also there's a lot that I don't know, but also there's a lot of stuff that I just take for granted. I don't maintain. And you're so true. I mean, even people like you, like me, I mean, anybody who's a trainer or been physically active long enough to like, oh yeah, I got this. No. We need help. We need these checkpoints. We need to go in for our maintenance. Like we take our car in every X amount of miles, so crucial.
The best coaches, the best providers always all have their own coaches and providers that they go to learn about their own body. So yeah, I'm excited to work on you because I think that it's probably another reason I went into PT is the ability to be hands-on and to touch people's body. We talked about trust and forming that therapeutic alliance with somebody that you're working with. And I find that hands-on can be this very, intimate relationship that you can start to grow with your patient client, make them feel safe, literally in your hands, whether it's your neck, whether it's their, leg. You might be working on people or touching them in places on their back or their leg or their glute that, someone might not have touched for a while.
Right. Yeah.
So that alone can be a very emotional and sometimes anxiety producing thing for a patient. So I just love being able to be hands-on with people and make them feel in that safe environment. Because again, that's where once they trust you, you might be able to start inching them towards that horizon event we've been talking about.
Yeah. And plus to kind of bring it full circle, when you can introduce a safe environment, you can help someone relax to work on an area where they're so fear prone, like we were just talking about.
Yeah.
I mean, that's crucial for the healing process, physically, mentally, emotionally, everything. It all needs to kind of come together there.
Have you heard of Dr. Bruce Lipton?
Oh, yeah.
Yeah, his book, Biology of Belief.
Yeah.
I read that one. That was like kind of one of my foundational books where I'm like, wow, what you said, an environment. So if we take 3 single cells, say a stem cell, and put it in 3 completely different environments, we can make bone, we can make nerve, we can make muscle. Same with a human. You put a human in 3 completely different environments, they are going to potentially have 3 completely different results. So you can do the same intervention. It's just whether the environment changes or not could completely change the result. He
was recently on this other podcast, former guest. It's gone out by now. And friend Tracy Dews, her show, the Hydrate podcast. They had an incredible conversation.
Heck yeah.
One of her early episodes, so good.
I'll have to look that up.
If you're into Lipton stuff, check it out. It's really good.
Oh, for sure.
Real quick, kind of getting towards the end here, it's all very well and good. We can keep learning. We can keep applying. We can get hands-on treatment. But what are some maybe like 2, 3, couple things that you would recommend someone to just like, here's what you could be doing on a daily basis, weekly basis? How can they check in with themselves physically just to like assess really?
Yeah, I think that primarily one of my suggestions to everyone is be your own best doctor, be your own best experimenter. Every day I encourage and invite people to ask themselves the question, how do I feel today? What did I do in the last day? What did I do in the last week that may have resulted in me feeling this way? And it's this constant, cycle of reassessment of yourself, the behaviors you do, and how you feel. We like to act like the way we feel just like pops out of nowhere. But that's really just us losing consciousness as to how our body's responding to the things that we do.
So true.
And the actions and the choices we make. And so bringing that awareness back to yourself. Everyone says that you should journal, which again is like cliche, just journal. Intentional journaling, right? You need to intentionally journal. And if that's your prompt, how do I feel today? And what the heck did I do in mindset movements or meals that maybe is making me feel that way? You can tease out so many different things that might be resulting in that, right? And that, again, that gives you back power. Other things that I think a daily practice needs to be breath work. I truly believe movement-wise, physiologic-wise, emotional, like when we do breath work, we set our state in the morning. I always say you can set your state with breath work in the morning, and at the end of the day, you can clean your slate at the end of the night.
Yeah, I like that.
So find a breath practice that helps stimulate you for the day. Find a breath practice that helps calm you down, wind you down. I take a warm bath almost every night and just do like 5 minutes of breath work in a warm bath. Like for me, that helps put pressure on my body, get all the fluids flowing back to my heart, use the breath to calm my brain down. And I get out, stretch, and get in bed, right?
You have your routine. That's the most important thing.
That's my routine.
You have a practice of paying attention to your body. Yeah.
And so I think the most important thing is to just try 2 or 3 things or one thing, right? And that's where we say like, you're going to feel which one's fit for you.
Mm-hmm.
I could sit here all day and list off 100 things that you should try, and I might not hit the one that's right for you. And that's frustrating. And a lot of people will try thing after thing after thing and say, it didn't work for me. And we can consistently and constantly focus on the things that don't work in our life.
Which we usually do.
Right? Of course.
For a myriad of reasons.
We're human.
Because we're idiots.
Yeah, and it's fun to complain, right?
Yeah.
And feel bad for ourselves. But, if you just continue to be open to the opportunity that you're going to run into the thing that works for you, you're going to run into it.
Yeah.
And it's just keeping that eye out and continuing to reassess on what you did that made you feel that way. Again, you're going to start finding the things that make you feel great, and you're going to start being able to take ownership that you did that.
That's it. Yeah.
Right on.
I mean, yeah, mic drop, man. That's
Boom.
so good. The most important thing here is that you learn, right? You pay attention, you pull from different resources, but then you bring it all back, you bring it home, and you take inventory.
Mm-hmm.
How do I feel? What are my thoughts around it? Physically, how do I feel? Mentally, how do I feel? What kind of satisfies a need? What could I do without? And just make it your own. The best thing you can do, the best practice you can do is just the one that you do. That's it. And keep doing it.
Absolutely. I mean, if you're ever seeing somebody who tells you that there's one thing that you need to do to fix it, or that you need to do this to fix this, turn around and walk out of that room. Like
run out.
Totally.
Yeah.
If you ever have somebody who tells you that what you're telling them isn't right, say thank you and turn around and walk out of that room. Like, you need to find the person that's going to treat you where you're at and help facilitate your ability to find those things. So, I know that everyone out there listening is going to be able to find that in their life.
Yeah.
Start today. If you haven't already started, get after it. Keep moving ever forward. It's been freaking awesome coming on here with you, man. So thanks for having me.
My honor, man. My honor. That's the last point, the last question I ask everybody. Ever forward, we have all these components, things that I introduce and try to share with my audience and my friends and my family and my clients of this helps me. Try it out, make it your own.
Yeah,
see, let me know what works for you. Maybe I'm missing something. Those 2 words, what does it mean to you? How do you live a life ever forward?
Wow, that's a really good way to ask. To end the podcast, how do I live a life ever forward? I think that I heard a quote from somebody that's kind of like resonated with me and stuck with me recently, and it talked about the stages of life, right? And that we go through all these stages of life, and often people will look back at a stage of life and say, oh, if I just would have done that differently, or if in that stage, if I could just redo this. And the quote said something like, rather than always looking back and wishing that we could redo one of the stages of life, let's just live each stage like it's already our second time.
Wow.
So another thing to just say, every stage of life you're going into, live it like you've already done it before, and you will be more likely to optimize those choices that you make.
Beautiful, man. I love hearing everybody's unique answers to this stuff. It's like, I know what it means to me. And, I grew up with my father just saying these words and instilling his belief system. And it just turned out, it really stuck with us. Mm-hmm. And then now being able to kind of just channel that and to hear other people's interpretation. And it's as much of a learning experience it is for me as it is, for just a cool question. I love this platform. I love being able to just, learn from people that are just experts in their field, experts in themselves, and just share. This is how I got to be me. This is how I got to just find fulfillment. This is how I got to pique curiosity and just light the gas behind it, I'm proud of you, man. That's awesome. I'm so proud that we have the ability to just do more and just push forward.
Totally, man. And I appreciate you and what you do with this platform and all your platforms, bringing people on, continuing to push good messages to get people good information that they can potentially dive in on their Horizon event and keep on moving.
I love that phrase, man. Well, Dom, it's been great having you on.
Absolutely.
Anybody who's looking for incredible mobility, mindset, movement, meals, just check them out. And this stuff is so much more than what you see. I always say, we're talking before we hit record, that I wish this is what they taught. I wish this is what people led with in the beginning. It's the mind. It's the mindset. Where the mind goes, the body will follow. And if you just pay attention, you're going to build your routine. You're going to build the best body for you, the best life for you, and move forward, ever forward, for sure. Dom, thanks, man. I'm going to have all your stuff listed down in the show notes, but real quick before we wrap up, where can people find you? Where are you hanging out the most online? Instagram, podcasts, YouTube? What's going on?
Instagram, I'm at Dr. Dom DPT. That's DRDOM DPT. And then I have a podcast with my fiance, the Optimal Body Podcast. We're really ramping up into that, having some awesome guests. Like you said, I just feel so like lucky that I get to have these people and learn from them myself just through these interviews. So we're really getting into that. Check that out.
Awesome. Thank you guys so much for watching. Thanks for listening. If you found value in this episode, share it out with somebody who needs to hear it. No doubt there's at least one person who could benefit from some mobility techniques, some mindset, or just someone new and cool to follow and to learn from via IG mentor. I mean, there's endless possibilities for continuing education these days. So thank you, everybody.